respected Dr. Sujata Chaudhary ji, Dr. Shanta Singh ji, Ram Mohan ji, Avinash ji, Nataraj ji, Vamsi Krishna ji, and all the executive directors, superintendents, vice superintendents, and all the stakeholders that are involved in this patient safety who have come across the country, as Vamsi ji said earlier, Kashmir to Kanyakumari, which is true. Thank you for taking the time and pain to reach here. But I hope you all must have appreciated the beautiful campus of AIIMS here. I mean, these are the times of reflection as well. These campuses are not born just like that. There is a tremendous amount of hard work involved in building these campuses, whether it is the vision of Sri Narendra Modi ji or Sri Nadda ji, or identifying the site between three hills with huge forest between, our visionary leader Sri Nara Chandrababu Naidu garu, and all the government officials involved in this process. I also wanted to thank for completely utilizing the existing campus by sanctioning additional posts, Sri Nirmala Sitharaman ji and Nitin Gadkari ji for giving access roads, and also Nadda ji for facilitating all of these things for the people of Guntur and Mangalagiri area. So I wanted to thank you for that. And second, I am not supposed to be here, but some reason yesterday they told me Nadda ji was not able to come. Can you come and talk about this patient safety? I said, usually I'm quite organized and I plan my events 1 week before, but patient safety is something that I have deep experience in the United States for the last 25 years. I thought I could add some value. That's why I decided to come here. So thank you for inviting me. This is a passionate subject for me, and I hope my talk would be somewhat useful to you. And second, this patient safety is an important topic. Why? Why it is such an important topic? Can any of you guess how many deaths are happening because of the medical errors within the hospital systems in India? Can anybody guess what would be the total number annually? So it's 5 million. So 50 lakh people are dying annually in India because of the healthcare related errors. I mean, it's a staggering number. If you take the same numbers in United States, annually it is around 250,000 deaths. Of course, we have 4 to 5 times population, but even if you multiply that, their death rate is 1 million, population adjusted metric, and we are 5 million. So we are 5 times more. And the average adverse event rate in US, if you take it, around 3 to 10%, depending on the studies across, but where we are 16 to 18% across all our admissions in India. I mean, these statistics are not to give you in a comparative downgrade, but it is actually to empower you and educate you why this is important. Second, medical safety is something that distills during the time of education. It's in the medical colleges. You look at it, even United States, being such an advanced country, spending billions of dollars for building the safety net, was not included in the educational system until 3 years ago. 3 years ago, they have instilled the entire patient safety into the medical educational curriculum. Now it's being routinely tested. I see a lot of medical students here. If any of you are planning to write USMLE, this topic is extremely important for you. So you pay attention to some of the things that I'm going to tell you. But even here, I suggest, since the Department of Health Sciences is here, until you put these things into the curriculum and you test some way, sometimes people may not take it seriously. And I request to consider that. That's one suggestion I have. So, and the medical colleges are such an important, and teaching hospitals, these are promoters of excellence. And I'm glad the government of India is actually recognizing some of these things so that we can truly become a developed nation by 2047. Without really understanding these and fixing these, we cannot become a developed nation by 2047. So I wanted to thank you for the Health Ministry for recognizing this. And number three, the reason is, if you look at it, in the medical, anybody, a physician or healthcare professional who takes an oath, start with first to do no harm. So what does that mean? In a complex, high pressure and limited resource environment, this ancient principle is our most vital anchor. If we remember that first to do no harm. Therefore, that is the third thing why this is morally, ethically, it is the highest calling point, because when you have limited resources and when you cannot fix the system, whether it is reporting or actually finding an appropriate solution, may be beyond many people's control, given the current healthcare system. However, having that moral principle and doing the things that are within your control can make a huge difference, and I'll give you some examples on why. And fourth, building a true culture of safety.